When will a coronavirus vaccine be ready? Though we can slow the spread of COVID-19, through confinement and other social distancing measures, and scientists are developing drugs to treat its symptoms, the only way to actually prevent people from catching COVID-19 is with a vaccine, and we don't yet have one of those. Nearly 80 companies and academic institutions are racing to produce one, and of those, 5 are already testing their vaccine candidates in people. The first of these to enter human trials, one produced by Boston-based biotech company Moderna, did so on the 16th of March. Hi. Welcome to MRA Plus channel. For supporting us, please subscribe, like, share, and leave comment. This unprecedented speed is thanks in large part to early Chinese efforts to sequence the genetic material of SARS-CoV-2, the virus that causes COVID-19. China shared that sequence in early January, allowing research groups around the world to grow the live virus and study how it invades human cells and makes people sick. Coronaviruses have caused 2 other recent epidemics, severe acute respiratory syndrome (SARS) in China in 2002-04, and Middle East respiratory syndrome (MERS), which started in Saudi Arabia in 2012. In both cases, work began on vaccines that were later shelved when the outbreaks were contained. One company, Maryland-based Novavax, has now repurposed those vaccines for SARS-CoV-2, and says it has several candidates ready to enter human trials this spring. Moderna, meanwhile, built on earlier work on the MERS virus conducted at the U.S. National Institute of Allergy and Infectious Diseases in Bethesda, Maryland. SARS-CoV-2 shares between 80% and 90% of its genetic material with the virus that caused SARS, hence its name. Both consist of a strip of RNA enclosed in a fatty shell through which protrude many protein spikes. The spikes lock onto receptors on the surface of cells lining the human lung, the same type of receptor in both cases, allowing the virus to break into the cell. Once inside, it hijacks the cell's reproductive machinery to produce more copies of itself, before breaking out of the cell again and killing it in the process. All vaccines work according to the same basic principle. They present part or all of the pathogen to the human immune system, usually in the form of an injection and at a low dose, to prompt the system to produce antibodies to the pathogen. Antibodies are a kind of immune memory which, having been elicited once, can be quickly mobilized again if the person is exposed to the virus in its natural form. Traditionally, immunization has been achieved using live, weakened forms of the virus, or part or whole of the virus once it has been inactivated by heat or chemicals. These methods have drawbacks. The live form can continue to evolve in the host, for example, potentially recapturing some of its virulence and making the recipient sick, while higher or repeat doses of the inactivated virus are required to achieve the necessary degree of protection. Some of the COVID-19 vaccine projects are using these tried and tested approaches, but others are using newer technology. One more recent strategy, the one that Novavax is taking, for example, constructs a recombinant vaccine. This involves extracting the genetic code for the protein spike on the surface of SARS-CoV-2, which is the part of the virus most likely to provoke an immune reaction in humans, and pasting it into the genome of a bacterium or yeast, forcing these microorganisms to churn out large quantities of the protein. Other approaches, that are even newer, bypass the protein and build vaccines from the genetic instruction itself. This is the case for Moderna and a German company, CureVac, both of which are building COVID-19 vaccines out of messenger RNA. CEPI's original portfolio of 4 funded COVID-19 vaccine projects was heavily skewed towards these more innovative technologies, but it has since added 4 others that take more tried and tested approaches, including a project at the University of Oxford that uses a harmless, non-replicating virus to carry SARS-CoV-2 genetic material into the body's cells, and it will continue to add to that portfolio. Our experience with vaccine development is that you can't anticipate where you're going to stumble, says Hatchett, meaning that diversity is key. And the stage where any approach is most likely to stumble is clinical or human trials. Sabin Vaccine Institute. There are good reasons for that. Either the candidates are unsafe, or they're ineffective, or both. Screening out duds is essential, which is why clinical trials can't be skipped or hurried. Approval can be accelerated if regulators have approved similar products before. The annual flu vaccine, for example, is the product of a well-honed assembly line in which only one or a few modules have to be updated each year. In contrast, SARS-CoV-2 is a novel pathogen in humans, and many of the technologies being used to build vaccines are relatively untested too. No vaccine made from genetic material, RNA or DNA, has been approved to date, for example. So many of the COVID-19 vaccine candidates have to be treated as brand new vaccines, and as Jelen says, while there is a push to do things as fast as possible, it's really important not to take shortcuts. Thanks for watching.